We use a computer to do computer-assisted surgery. And it's done for total knees right now. We're going to start doing total hips. So it sits at the Valdez OR, and I use it every week, and it's so much more accurate. Essentially what you do is, first of all, it's been proven that our eyes can't tell the difference between like about 10-degree angle in surgery. So what they're doing is they're putting this rod up the thigh bone and hoping to cut the bone between a 5 and 7-degree angle. Sometimes you get it, sometimes you don't. But really, if you're trying to do that, then it doesn't necessarily do that. Now we have this new technology to assist in surgery, computers. Now what does a computer do? We don't put any rods up into the thigh bone or into the shin bone. Basically what we do with the computer is we put these computer arrays on the knee, and then we trace out the knee. And when we trace out the knee, the computer creates a model of the knee. So then you have a model of the knee on the computer, and before you start cutting it on the patient, we can do all the cuts, we can do all the planning on the computer. We change it to the levels of resection, and then say, okay, that's what we want. And then the computer's still looking at the knee. Then you put this sensor on the knee when you're doing it, and it tells you with your hand, are you within a millimeter or a degree of where you should be. And then you cut it. So each step of the procedure is guided by the computer. You still do it physically. I would never have my knee down without a computer.
Okay.
After having done thousands the other way, this does add a little bit of time to the surgery. I think that's why some people don't want to do it. It also, it's not necessarily easy to do. You have to be more perfectionist when you do it this way. And we've been doing it for 2 years. I can't tell how many patients I've done now, and I do between 2 or 3 a week like that. We got pictures everywhere of the knees, and then you've got the computer that's just giving us another image. It's pretty cool. It's really cool, actually.